It may have seemed foreign at one time, undergoing an operation performed by a robot controlled by a surgeon. But within 10 years of robot-assisted surgery becoming available, it's now the go-to approach for some procedures. Here's the latest in this edition of Positively Healthy. Less is more when it comes to surgical procedures. For many years, the standard approach was to enter the body through a large incision in what are referred to as open operations.
And they tended to be more painful. There was more blood loss for certain surgeries, and patients had a longer recovery time.
Nowadays, new tools and techniques help doctors achieve the same results with less trauma to the body. Perhaps the most precise and least invasive is robotic surgery.
And the robot took laparoscopy and minimally invasive surgery, but made it a much easier approach. And by sitting at a console and controlling the robot just by hand in a comfortable position, next to you in the operating room is the patient with the actual robot.
A robotic surgery system offers better visualization coupled with instruments that move like a human hand, only better with full circle wrist action.
And you can do things like tying knots, sewing and cutting and those sorts of tasks much more easily.
Board-certified urologist Alexander Rosen finds robotic surgery is especially well-suited for his field.
There are a couple elements of that made urology one of the first to pick up on this and become a robotic, a heavy robotics specialty. One was where the prostate is.
Like many things, it comes down to location, location, location. The prostate is easier to access using the robot because of its location in the body.
It's in the middle of the body, down low in the pelvis, and when we operate, we're typically on the side of the patient. So to do minimally invasive surgery, you're always tilted and twisted, and it was difficult. So robotic surgery for the prostate was one of the first big utilizations of the robot.
Benefits don't stop there. Prostate patients on average report a better overall experience.
So with the robot, we're talking about a surgery that takes a couple of hours. A patient has typically one night in the hospital, so it's a very quick recovery. And then with the minimally invasive surgery, pain ends up not being a big issue for them.